Hi everyone. Today I am giving you explanation about the topic entropion. It is defined as the inturning of the lid margin. Let us understand with the help of diagram. This is the lid margin and these are the eyelashes. So in entropion, the inturning of the lid margin. The lid margin get inturned. Due to its inturning, the eyelashes also get inturned towards the cornea and conjunctiva. Types of entropion: there are four different types of entropion: congenital entropion, psychiatrical entropion, senile entropion, and mechanical entropion. First of all, we discuss the congenital entropion. It is a condition occurs since birth. It affects the lower eyelid only. In our eye, two eyelids are present, upper eyelid and lower eyelid. So it affects only lower eyelid. It is associated with a microphthalmos. Microphthalmos is a condition in which size of both the eyes is different. Next type is psychiatrical entropion. In psychiatrical entropion, it affects upper eyelid only. It occurs at the time the healing of the wound takes place. When the eye suffers from an injury, then its healing takes place. At that time, psychiatrical entropion takes place. It is caused by psychiatrical contraction of palpebral conjunctiva. In this case, the palpebral conjunctiva gets constricted. Common causes are chemical burns, trachoma, it is an bacterial infection, and Stevens-Johnson syndrome. Stevens-Johnson syndrome is a syndrome which is related to the mucous membrane and the skin, in which the skin has blisters are present. The top layer of the skin affected, it gets dies and shreds and begin to heal after several days. Next type is senile entropion. It is age related. It affects the lower eyelid in the elder people. It is also known as involutional entropion, or we can say that senile entropion is another name of involutional entropion. Our last type is mechanical entropion. It occurs due to the lack of support provided by the globe to the lids. Globe is considered as the orbit of the lids, and the support of the orbit gets lack of the support provided by the orbit to the lids, due to which mechanical entropion gets developed. It occurs in the patients which are suffering from phthisis bulbi. Phthisis bulbi is a shrunken eye which is a complication after the surgery, and the eye gets shrunk. Enucleation means eyeball removed from the orbit. From the orbit, the eyeball gets removed and the patient have to live with the artificial eye whole life. And anophthalmos, it is a functional loss of orbital muscle. In our eye, orbital muscle is present which is attached to the orbit or a globe, and its functions get lost. The functions which are performed by orbital muscles are not performed by our eye. Overall, mechanical entropion occurs when the nutritional fat get absorbed. Symptoms: rubbing of cilia against the cornea and conjunctiva. Cilia are the eyelashes or the hair particles which rub against the cornea and conjunctiva when we close or open our eyes. They get rubbed against and again and again. Lacrimation, over secretion of tears occurs from the eyes. Photophobia, discomfort while looking at the light. Irritation occurs, and foreign body sensation occurs in our eyes. These are the symptoms. Now signs. Signs are classified into different grades. Grade 1, only posterior lid border is enrolled. Now this is a posterior border. It get enrolled means it get moves inside our eyes towards the cornea and conjunctiva. This is our grade number 1. Now grade number 2, turning up to the internal marginal strip. Internal marginal strip. This is the internal marginal strip where we wear the kajal. That is internal marginal strip. That marginal strip get intern. This is the grade number 2. Now the third grade, whole lid margin including anterior border is intern. Whole lid margin including the anterior border. This is the anterior border where the eyelashes are grown. It get intern along with the lid margin. Means this fully gets intern inside our eyes. This is the grade number 3. Now move to the next slide. Complications: recurrent corneal abrasions. Scratches on the cornea occur due to rubbing. Superficial corneal opacity, cornea gets opaque. Corneal vascularization, vessels on the cornea grows as the cornea is a transparent part of our eye. Treatment, congenital entropion, it resolves with the time and rarely requires surgical treatment. Psychiatrical and senile entropion require surgical treatment only. Thank you.